So what is tendinitis? So traditionally it was considered inflammation, thus itis. So that's the Latin derivation of inflammation. People used to think it was just tendinitis, then figured out, well, every time we look at it under a microscope, we don't really see evidence of inflammation. We don't have any biomarkers of inflammation. So it's really not inflammation. It's more like a degenerative process. Well, since then, more recently, we've actually figured out there is inflammation, but it's chronic low-grade inflammation, just like what causes atherosclerosis, just like what causes diabetes, just like what causes neurodegenerative disorders, just like what causes arthritis, cancer, so on and so forth. Excuse me. So it is chronic low-grade inflammation. So kind of almost think of it like self-attacking. The little picture on the right with the pink, that shows you kind of where the Achilles is going to drop in and be irritated. And you can see there's like a little notch. I'm sorry, I don't know why I'm having this problem. I need something with carbonation. And I don't have it. So you have that little notch where the Achilles drops in and inserts. The Achilles drops in, and if you look on the back of that picture, you see how it goes like this and then drops down. Then there's a little notch. Well, the tendon drops right into that zone. That little right angle where it's pink, that's actually what we call the Haglund's deformity. So Haglund, Haglund. There was a Dr. Haglund who named this at some point. That is sitting on the front edge of the Achilles. So imagine this is the Achilles tendon, and this is that Haglund's. So every time you extend or use your calf muscle, it's like jamming up against that bone, and people will get like a bursitis and a pain in there. So that is what people have pain. So sometimes when all else has failed, what we'll have to do, and I actually just did this recently, I did it minimally invasively. So through a teensy tiny incision and a little side cutting burn, we do it under x-ray control. You can actually smooth that Haglund's thing down. So it's no longer doing this. You've smoothed it down, and it gives the tendon that much more room to kind of move around without having that pressure pain. Now, on the right side, that is a rotator cuff, believe it or not. That round thing is the humerus, so the arm. And then the little thing on top is the acromion. Well, that curly Q comma looking white thing is actually calcification inside of the supraspinatus tendon or the rotator cuff tendon. So you actually get deposits of calcium in a tendon, which obviously you don't want that, right? It would stiffen it, it would make it not work well, and guess what? It hurts. Well, this is a very common problem. It's actually, we now understand, a continuum that starts very early on. There's no like signs on radiograph or MRI or anything, but people start getting stiffer. They have a little bit of pain. Nobody can really figure it out. Well, because it presents that way, it then evolves, becomes extremely painful, very stiff, and then the calcium starts to deposit. And then over time, in a lot of people, it'll resolve and get better. It just takes forever. So the ways we hurry this up is with physical therapy, different anti-inflammatories, and then sometimes you can actually take a needle and go in and break up that lump of calcium in the tendon. So lots of different ways for tendinitis to present, but we now know that it's generally not an acute inflammation like what would happen if you had like, you know, a cut on your skin or something like that, or a bone break. It's more chronically inflamed with the associated damage to the tendon structure. And we're going to talk about all that.